Hello everyone, my name is Oluwatoyin Ibiranke. I am a fourth year medical student at Oakland University William Beaumont School of Medicine. My medically challenging case will be on the challenges of pain management in the context of suspected medication divergence. As of 2018, the national drug overdose deaths involving select prescription was about 14,975, which is a concerning topic in our country. My case presentation is about a 46-year-old male with a history of chronic pain and opioid dependence who came to our clinic for a refill of his Percocet, which was prescribed after a laminectomy for use every 6 hours. He stated that he was not getting adequate relief and proper functioning on his current regimen and wanted an increase in his dosage. He also refused to take any other pain medication aside from Percocet. On further questioning, he was required to provide a urine sample for drug screening, which he initially refused to do. He later provided a sample which tested negative for opioids. After discussing with the patient, he stated that he last used his medication 12 hours before his appointment. We were concerned that the patient was diverting his medication and non-adherent. We will discuss the challenges in treating pain patients with suspected medication divergence, risk factors for opioid dependence, and methods to prevent medication diversion. Some of the risk factors for diversion include poor social support, personal and family history of substance abuse, preadolescent sexual abuse, exaggeration of pain, unclear etiology of pain, and psychological diseases. Some signs of medication diversion include strange stories where the patients constantly come in saying they lost their prescription or their medication got flushed down the drain. Sometimes these patients are also reluctant to cooperate, like my patient who refused to give us his urine for drug screen. Some refuse to actually get a physical examination. They also sometimes request for specific drugs, such as my patient who requested only for Percocet. And sometimes they are extremely knowledgeable about these medications or very familiar with the medications. Ways to prevent medication divergence includes providing thorough care. This involves providing good physical examination, getting complete history and physicals from these patients. We can also use patient medication agreements where we outline the goals of therapy and talk about the overall therapeutic plan with the patient. So we ensure that we are meeting our goals and we are meeting realistic goals. We also want to do periodic screening of urine to check for illicit substances and check for medication adherence. It is also important that physicians protect their prescriptions. They should avoid leaving their prescriptions blank and signed on their tables, and also communicate with the pharmacists because sometimes the pharmacists detect medication divergence even before the physicians do. In conclusion, when managing acute or chronic pain, it is very important to evaluate the patient thoroughly and consider prior medical histories. It is also important to set up treatment goals and ensure there is an effective mode of communication between the physician and the patient, as well as effective patient education. Physicians should ensure that they are enrolled in prescription monitoring programs and protect their prescriptions. Thank you.